Good day, I am Shine Fansay RNS and I will discuss the nursing intervention of Nursing Care Plan number 2. For the independent, assess patient's ability to perform normal tasks, noting reports of weakness, fatigue, and difficulty accomplishing the task. Rationale is it influences choices of interventions, needed assistance. Note the changes in balance, gait disturbance, muscle disturbance, and muscle weakness. Rationale may indicate neurological changes associated with vitamin B12 deficiency, affecting patient safety or the risk of the injury. Monitor blood pressure, pulse, respirations during and after the activity. Note the adverse response to increased level of activity such as increased heart rate, blood pressure, dysrhythmias, dizziness, dyspnea, tachypnea, cyanosis of mucous membranes or the nail beds. Rationale is cardiopulmonary manifestations result from attempts by the heart and lungs to supply adequate amounts of oxygen to the tissues. Recommend quiet atmosphere, bed rest if indicated. Stress need to monitor and limit visitors. Phone calls and repeated unplanned interruptions. Rationale is it is to enhance stress to the lower body's oxygen requirements and reduce strain on the heart and the lungs. Elevate head of bed as tolerated. Rationale behind this, it is to enhance lung expansion to maximize oxygenation for cellular uptake. The note if may be contraindicated if hypotension is present to the client. Suggest patient change position slowly to monitor for dizziness. Rationale is postural hypotension or cerebral hypoxia may cause dizziness, fainting, or increased risk of the injury. Assist patient to prioritize ADL's desired activities, alternate rest periods with activity periods. Write out scheduled for patient to refer to. The rationale is to promote adequate rest, maintains energy level, and alleviates strain on the cardiac and respiratory systems. Provide or recommend assistance with activities ambulation as necessary, allowing patient to do as necessary allowing patient to do as much as possible. Rationale is, although help may be necessary, self-esteem is enhanced when patient does some things for herself or himself. Plan activity progression with patient, including activities that patient view as essential. Increase activity level as tolerated. Rationale is promote gradual return to the normal activity level and improve muscle tone, the stamina without undue fatigue. Increases self-esteem and senses of control. Identify or implement energy-saving techniques like example nito is shower chair, sitting to perform task. Rationale is encourages patient to do as much as possible while conserving limited energy and preventing the fatigue. Instruct patient to stop activity if palpitations, chest pain, shortness of breath, weakness, or dizziness occurs. Rationale is cellular ischemia potentiates risk of infarction and excessive cardiopulmonary strain. Stress may lead to decompensation or failure. Discuss importance of maintaining environmental temperature and body warmth as indicated. The rationale is vasoconstriction, shunting of blood to vital organs, decreases peripheral circulation, impairing tissue perfusion. Patients' comfort or need for warmth must be balanced with need to avoid excessive heat with resultant vasodilation or reduces organ perfusion. For the collaborative, monitor laboratory studies. Rationale is it is to identify deficiencies in the red blood cell components affecting oxygen transport and treatment needs or the response to the therapy. Provide supplemental oxygen as indicated. The rationale is maximizing oxygen transport to tissues improves ability to function. Administer as indicated. The colony stimulating factors like aldesleukin or the Interleukin-2, the rationale behind this is maybe given to stimulate growth of specific blood elements. Whole blood pack RBCs, blood product as indicated. Monitor closely for transfusion reactions. The rationale is increases number of oxygen-carrying cells, correct deficiencies to reduce risk of hemorrhage in acutely compromised individuals. Note, transfusions are reserved for severe blood loss anemias, cardiovascular compromise, used after other therapies have failed to restore homeostasis. Prefer for surgical intervention if indicated. Rationale is bone marrow transplant may be done in presence of bone marrow failure or the aplastic anemia.